Hi, I'm Steve Frank. Thanks for joining me today. I have some rather interesting and very important information to convey to you regarding sinusitis. Quite specifically, I want to help you understand why antibiotics are not the appropriate means for dealing with sinusitis and what natural means are effective. Let's start first by understanding that there are and always will be bacteria and fungus in your sinuses. You breathe these little microbes in the air surrounding you every day. When the sinuses get closed off due to allergies or a cold, the bacteria and fungus enjoy this. They enjoy that sealed environment and they can multiply faster than your immune system can keep them in check. This overload of microbes is called an infection, specifically a sinus infection or sinusitis. Now, let's get to the interesting part. Antibiotics work by killing the bacteria that they encounter through the microcapillary blood distribution system. When you take antibiotics orally, they have to survive your stomach, then not be degraded too badly by your liver. Then they're distributed throughout your entire body to a concentration high enough to be effective in your nose. This is not very efficient. What's more, it's killing bacteria all over your body, and this is not necessarily a good thing. There are several groups of antibiotics that kill in different ways and kill different bacteria. So your first sinus infection, you'll probably get an antibiotic that kills all the easy-to-kill bacteria. This leaves room and food for more robust microbes to move in and take over. After several infections and several different courses of antibiotics, you've killed all the easy ones, and the fauna of bacteria in your sinuses has shifted to become made up primarily of difficult-to-kill bacteria. This is where your physician will begin to suggest surgery. Additionally, you may have experienced yeast infections as the bacteria that got killed in other parts of your body allowed the local fungi to move in on that real estate and food that were no longer being utilized. Now you're left with a fauna of bacteria that are not very responsive to antibiotics. This is an unfortunate condition. Let me tell you what complicates this situation even more. A few years back, a researcher at Mayo Clinic, who shall remain nameless, discovered that sinus infections are primarily fungal. Well, duh. It's true that everyone has fungi in their sinuses and that the sinuses get out of balance and bacteria are regularly and indiscriminately killed. The fungal flora can become rather extensive. The real problem is this. The layer of fungus can excrete exotoxins that irritate the sinus tissues and keep them inflamed, causing congestion and sealing them off, which provides the perfect environment for the bacteria to flourish. Here is your nasal tissue. Then, on top of that, we have a fungal growth. And on top of that, out of reach of the immune system, bacteria hide with impunity. Now we have a double problem. The fungi that are not susceptible to antibiotics are here, and they're keeping the bacteria away from the antibiotics, which will be coming from the tissue side. So what are you going to do? Rather than taking systemic antifungals and antibiotics that have to be distributed throughout your entire body just to treat an infection in your nose, why not spray an agent that's antifungal and antibacterial directly into your nose? In this way, you can kill the fungus and bacteria directly and at the same time. See how well that works? Kill, kill, kill. Not only does it kill both the fungus and bacteria, but the total dose that you'll need is far less than if you have to ingest it. This antimicrobial spray goes exactly where you need it, and only where you need it. A far more efficient and appropriate means for attenuating this out-of-control microbial overgrowth. Even better, This particular active agent is called a broad-spectrum antimicrobial. This means that it tends to kill a very wide range of microbials, not just one type, not just the easy-to-kill ones, so it doesn't leave you with a fauna and flora of only hard-to-kill types. What is this spray, you ask? Well, that's what I'm here to tell you. This spray is called Sinus Relief, and it is one of a three-part system of natural products to relieve sinusitis and maintain healthy sinuses and stop congestion. It's very affordable, easy to use, and wonderfully effective. Now, here's the catch. Your normal mucosal flow and the interstitial ions and polysaccharides in your sinuses will neutralize and flush away what you spray into your nose within about 20 to 30 minutes. Bacteria can double in number every 20 to 30 minutes. In order to kill them at a rate far greater than they can rebuild, you must spray the sinus relief into each nostril every 20 to 30 minutes. You need to do this all day. If you only spray it a few times a day, it won't work. The bacteria will be killed and then grow right back to the numbers they were before. If you do spray it every 20 to 30 minutes, you can terminate an acute sinus infection in as little as 2 to 3 days and a chronic, never-ending sinus infection in a couple of weeks. No surgery, no antibiotics, no follow-on yeast infections or diarrhea. A simple, inexpensive, natural solution. This patented solution to sinusitis has been used successfully by hundreds of thousands of sinusitis sufferers just like you. It's even used by one of the premier sinus expert doctors in this country. So what's in this stuff, you ask? Well, it's primarily a pure aqueous colloidal suspension of nanometer-sized silver particles. This then augmented with a surfactant to increase its antimicrobial effectiveness far beyond a simple silver colloid. This patent-pending combination has shown phenomenal effectiveness in laboratory and clinical testing. Now, some of you have heard that ingesting silver will turn you blue. Yes, if you drink about 10,000 bottles of this in a year's time, you'll experience some pigment change. But considering that you'll likely need only one bottle to get rid of your infection, you'll be ingesting about the same amount of silver that you would normally get from eating, drinking, and breathing for about 10 days. It's simply not an issue. Silver is found in water, in air, in food. Sinus Relief is sold as a dietary supplement since it's ultimately being ingested. But make no mistake. This active agent, in this concentration, when administered directly into the nasal area and reapplied every 20 to 30 minutes, is an extremely effective antimicrobial. It is the key to stopping sinusitis without the use of antibiotics. What I'm seeking to do is to empower you to take control of your nasal health. With these simple tools and the simple 20 to 30 minute spraying protocol, you can stop sinus infections better, faster, and in a more holistic manner than any surgery, antifungals, or antibiotics. If you know someone with sinus problems, you owe it to them to show them this information. If you want to learn more, visit my website at www.naturesrightremedies.com, just like it says at the bottom there. I welcome your comments and thank you for your attention. Best of health.